people to hop on. If it's poor, give me a thumbs down so I know. Perfect. Thank you guys. If you can put your cameras on, it's always nice to see your guys' faces. But as always, we appreciate you hopping on this call and spending your Monday morning with us. Definitely grateful for this team right here. We've had a great start to our AEP, and we've also had some consistency on the advanced market side and the life side as well. We're definitely leading the charts on the Medicare side just because of the season, it being AEP. So we definitely want to hear from some of you guys who are out there and on our leaderboard for Medicare here. But if you guys had a great week last week, drop 100 in the comments. If you guys are excited to hear about our numbers this week, drop 100 in the comments. Let's just get interactive here and kind of kick off our morning. What's up, David, Ed, Ada? Nice to see your faces. Awesome. So I'm hoping as we kick off this call, what's up, Mar, that we can get some feedback from some of you who are running out in the field right now for AEP. I know we've spoken the last week or two on utilizing Medicare Link. If you have utilized that system versus Medicare app or versus the back office portals for the carriers, if you can just drop a Medicare or drop link in the chat so I can see who's utilizing that. I know Mar has been running Medicare as well as Karina and Beto here for the last year or so. So I'm curious to see if you guys are using Medicare Link, if you find it helpful. But if you guys, Mar, are you available to unmute?
Yes.
Okay, cool. I wanted to see, are you utilizing Medicare Link? And if you are, is there a reason for you, just because you have some longer experience than some of us on here, is there a reason why you would utilize that over something else, like Medicare app?
Yeah, so I actually use so for me, my only two that I run are usually just WellCare and Anthem. So I actually just do them straight through the portal.
Okay.
I do them straight through the portal just because when I do WellCare, as soon as I go to fill out that HRA, it takes me straight to the HRA with all their information inputted. When I do it from Connecture, which is Medicare app, I have to click another link to take me to the HRA, and then I have to input the first and last name. I have to put the Medicare number again, date of birth. So it was just a little too repetitive for me to do those over Connecture. Yeah. So I do it straight through my Ascend portal for WellCare, and then my application straight through Anthem portal now.
Oh, okay. So that's good for all of us to know then too. It's probably based on carrier. Thank you for sharing that. Because for myself, the carriers I've ran, I'm able to access the HRA all from Medicare Link. And so it must just be based on carrier then. So that's actually really helpful to know. There are times too, you guys, that I'm utilizing the carrier portal and kind of using it as an assist to Medicare Link. And that's when I'm going to look at Medicaid eligibility. I will call the WellCare line and verify Medicaid eligibility and the level because they're pretty quick. If you guys don't have that phone number, we'll drop it in the chat here. If someone has that Medicare WellCare number, you do have to be licensed and ready to sell with them in order for you to call this hotline, because you have to have your NPN, last four your social, and verify your name. But the reason I use the carrier to confirm the Medicaid level for United Healthcare, for example, because we ran into where the Medicaid level needed to be long-term care rather than just QMB plus, which is what we were kind of used to being the top tier of the level of Medicaid that would get them into a DSNP out here. But utilizing United Healthcare's Medicaid eligibility check helped to verify whether or not that person would be able to get into that plan that we were looking at for them. So there are benefits to going directly to the carrier to kind of bounce off of Medicare Link and the carrier's eligibility requirement. But Medicare Link is very helpful because what you're able to do is actually see what the cost is of the medications when you put it in and what the tier is. So that's been very helpful for me because I wasn't seeing that in the Medicare app. I know Gage has said the same thing, and some of you may be experiencing the same thing. Teresa, I know you're driving, but are you using Medicare Link as well? You are? Okay, awesome. Yeah, and I think
Yes,
there,
ma'am, I am.
okay, awesome. Is there any from what you were using before, is there anything that you would want to share with everyone on here on as to why you're using that one? Because I feel like it is much more helpful. It lists kind of in order what plan you would start with, you know, in choosing for the client. But what is it for you?
Well, this is my first time using it, but I've only used that. I wanted to stay consistent with whatever CRM I was with because I didn't just want to be everywhere.
Yeah.
But it does seem to have a lot of information. There's a few things that are a little hairy for me too, but I'm starting to get much more comfortable with using it.
Okay, awesome. Yeah, and if you have any questions on just the part that might be confusing or what you want to understand more too, let us know so we can help you kind of look into that as well. But that's great. Yeah, Medicare Link seems to be kind of the most robust out of all of them in choosing the plan. If someone else knows a better trick to saving the client's information, let me know. I feel like you have to keep that little link code that's at the top saved and enter that back in if you need to go back into someone's profile, like before you go and enroll them. So if anyone knows anything about that, being able to search for the contact before you're actually going to enroll, if you want to share that, I think that would be helpful as well.
I did want to add a little tip. Like Anthem, I know with Tiffany, I know Anthem's out there, you know, Anthem's with you, Ashley. So what's been working for me is, like I said, I've been doing it through the portal with Anthem. And then I actually look up the plans first. Like if I know I'm gonna write like an Anthem D-SNP, I'll go and I'll search the plans in the Anthem portal. And then I'll click the D-SNP, right? And it'll actually throw in the eligibility, like the eligibility pop-up will actually pop up and say, okay, before choosing this plan, let's see if they're eligible. So you actually input the first, last name, Medicare number, Medicaid number, all that information. And then it'll say, you know, full level, so she's able to, you know, apply. Once you hit continue, it again goes straight into the app for you. So it just cuts your time in half about having to put in the first, last name and all that stuff again.
Oh, that's great. Yeah, that's a good tip. That made me think of this too, Mars. I know we've said this here before, but as long as you guys have the client's social and date of birth, if you don't have their Medicare ID number or their Medicaid number, you can call into that WellCare number and get
Okay.
the Medicaid and Medicare number.
Yes.
And that's helpful. So then you can plug that in as well.
Yeah.
But Mar, if you can, will you share if you have one of your I don't know if you've had anyone out there.
You muted, Ashley.
You
Sorry
cut
about
off.
that. I was gonna say, Mar, if you have any type of unique situation that you want to share with everyone on here, maybe it was someone who was falling off their eligibility to be on a D-SNP and you had to pivot into a C-SNP, or if there's anything that you had in this last week, if you just want to share. I know we kind of wanted to talk to some of our top guys on here today and just kind of get an interactive training. And the best way to do that is just kind of share an example of maybe a case that you had this week. Do you have anything to share? If not, I can, while you think about it, we can move to someone else. But
I think I had 3 appointments today, or sorry, last week. It was a his and hers, and then just another appointment for a lady. But I think those went pretty smoothly. It was just, you know, asking the questions, you know, like they were just on Medicare, WellCare HMO plan, and they were saying how their new plan, their formulary had gone up for 2 of their diabetic pills, right? So it was just, a matter of asking, okay, well, you're taking these prescriptions for, diabetes. So, you do fall under that chronic special needs plan. And, it's just really being a little bit more educational with your clients because they don't know that there's a chronic special needs plan. They don't know there's a dual special needs plan. So I think it's really just being informative more than, telling them, hey, you need to switch to this one. Like, let them decide, obviously. And I mean, education and information is always, it's always going to win. So, it's really just throwing that out there. Hey, there's a chronic special needs plan. I'm not sure if you know what that is, but it's pretty much anybody that has a chronic condition, such as diabetes, and both of you guys have diabetes. So, this will really help towards, either prescriptions and just kind of give you that extra help. So, that's really my only issues there is just people not knowing what there is out there to help them. So with Medicaid though, I'm luckily, let me knock on wood, I have not ran into someone coming off of Medicaid or anything like that yet. So
No, that's helpful too. You said education and information is always the way to go, and I feel like that's definitely the best approach to take. It's once you run your first few, it's easy to see that you're not going in there to sell anything. You're just there to
mhm,
help inform them and educate them. And a lot of the
yeah.
times, the way that I've built trust with people when I've started out is just going in and educating them on their current plan, and then letting them know, hey, if there's any gaps in here, if there's anything that you're lacking or anything that you feel like you're coming out of pocket for more than you have in the past, then maybe we can take
Mhm,
a look at that and see how we can enhance your plan. If you're in the best plan, I'll be the first one to let you know, and just, go over the benefits that you currently have. But if we can find
mhm,
you something to put you in a better position, then we'll be able to do that today, and that would start January 1st. So yeah,
yeah.
I think starting off just talking about their current plan and figuring out, that needs analysis is really everything. That's like our bread and butter for sure. And figuring
Mhm,
out what they're spending money on, maybe where they could be saving some money. But also too, just as a reminder, you guys, the hospital indemnity plan has been a great add-on for some of my clients, because I had a woman that I sat with, and she had told me she was in the hospital 4 times in the last year. So when I brought up the hospital, I asked her, I said, hey, did you get a bill from the hospital? She's like, yep, we got a bill. It's like $175 for the first 70, or I'm sorry, for the first 7 days that she was in the ER. And so we got her a hospital indemnity plan on top of her Medicare Advantage to just fill those gaps and just kind of lower her exposure. And she ended up she wanted to do 31 days, $600 a day, and add the outpatient surgery on there. And for her, she's thanked me like 3 times over text, and her husband too. Hey, just want to thank you so much for helping us out with that. We didn't even know about that. And that was like $150 a month premium for just hers alone. And she's thanked me like over and over again. And I kept trying to down close her. I'm like, maybe we do $300, dollars a day for 31 days, or maybe we do, just cover where you're going to be exposed as far as what you're going to get billed. And she was adamant. She wanted the 31 days for $600 a day. So it's definitely just positioning yourself correctly to ask for those cross sell, or to go after those cross selling opportunities. But the product portfolio has been very helpful for that for me as well. Unfortunately, in these Medicare appointments I haven't ran into an opportunity on the annuity side, but I know I'm going to keep hitting it, and I will uncover those, and I'll be bringing them right to David, because I want to make sure that, I'm not just going in there and just helping them with the one thing that I've got that day. I want to fill out that, essentially, I want to get that product portfolio completely filled out for every single client. And as long as you're using that, you can slide that over to the client. It's just a form that has all the things that we're qualified to help people with a check, a little box that they can check. And I have them check the box on what they want more information on, or what they currently have, so that I can keep that in my file to make sure I review the rest of that information with them. So their life insurance, any dental, vision, hearing, hospital indemnity plan, annuities, IULs, things like that. But if you slide that over to them and have them check the box, then that can be something where you start to build a, client for life on every I guess, level possible with what we do. Uh, I have, let me see on here. Lauren, do you have the ability to unmute?
Yeah, I'm in a car, but I can unmute.
Okay, I was gonna say, so you're our top agent right now, so I wanted you to share a couple tips with everyone on here. I know that you just moved from your hometown to Nashville. You spent a big chunk of your AEP out here in Arizona with me. I was lucky enough to have you out here with the team helping, training. Everyone got to see kind of what you do day to day, and it was amazing. And I think that you have so much value to bring to this team. And so if you wanted to share a little bit about how your experience has gone, and maybe if you just have a couple of tips for people. Like I said, I kind of wanted this to be an interactive call here, sharing kind of our wins and any special tips that might be helpful for others. So if you want to share that.
Yeah, for sure. Yeah, going out to Arizona definitely was awesome just to get around everybody and be able to learn from each other because like everyone else, I am fairly new to Medicare. I was running a little bit of it before AEP, but I definitely did not know as much as I do now. AEP has definitely been a learning experience, especially like you said earlier with the Medicaid levels. I've learned a lot with that, and definitely going to start utilizing Medicare Link more often than the Medicare app. It just has definitely been easier than Medicare app, definitely. And I'd say running out in Arizona, I preferred it a little bit more than Tennessee just because out here it's a little more driving time. But I've liked the people that I've met, and it's been really nice to be able to help them out, especially because some of them, they're not in the position where they have someone that's willing to help them find the best plan for them and save them the most money and do all of these things for them. And I've also been utilizing the hospital indemnities. I've found that if they're not on a DSNP, like I'm going to bring it up because everyone should cover those gaps because they're all going to be subject to paying those copays one way or another because everyone's going to end up in the hospital. It's inevitable. And how do you get to the hospital? Ambulance, go to the ER, then you stay in the hospital. So it's a pretty easy sell for that, especially when it's so cheap per month to add on to it. And I pitch it to them like it's a hospital reimbursement plan, like it's an add-on to their current coverage. It's going to cover those gaps for hospital copays. And that's been a great add-on for a lot of people. They've been very happy with that. And as far as tips go, I'd say start utilizing those hospital indemnity plans. I've been trying to do it every time I get the chance. And sorry if you guys hear background noise, we're picking up furniture right now. But I'd utilize them as much as you can. Make sure to always call WellCare or a verification line. That way you can make sure that you know what level of Medicaid your client is on, because I've run into some bumps in the road with that I've had to fix, which is not a big deal, but just to be more aware of what levels they're on and what they mean exactly, and to look at those summary of benefits to really read into what they are accepting for each plan because they're all different. Trying to think of anything else, but I'm a little stuck. So I'm not sure. Do you have anything else you'd like me to talk about?
No, that was helpful. I think that's important too. You brought up such a good point with the hospital indemnity that I like how specific you were. You know, you said if they're not on a DSNP, you're bringing it up, which is a great point, because if they are on a DSNP, I didn't mention this, but that's such a great point because on that side they're going to be covered through Medicaid and Medicare. They're going to bill as a primary and a secondary, but on that, is that why you're doing that, right? Because they're billed primary, secondary, or do they still have that hospital bill?
Say that again.
Were you doing that for affordability reasons, or was that because they have the primary and secondary and then they won't be exposed to that bill that, you know, the first 7 days that they're in the ER?
I was doing it to cover those first week of copays that everyone is subject to if they were to go into the hospital without being on Medicaid and Medicare.
Okay. So yeah, so if they have Medicaid and Medicare, it's kind of billed like a primary, secondary, so they won't be exposed to those copays and those, you know, that first 7 days when you're in the ER. But for everyone else, yeah, that's a really good point.
Yeah.
Lauren, have you had experience with having someone fall off the DSNP and having to put them then on a CSNP, or maybe they don't qualify for a CSNP, but they they did fall off the D-SNP. Have you kind of fell into that?
Yes, I have. So, well, I was actually sitting down with a woman in Arizona. I believe Andrew was with me, and she had recently moved down to Arizona from Michigan, and she lost her Medicaid status. And she's like, I'm not sure like what plan I'm gonna be on or where I'm gonna be thrown into. But the more we talked to her, we realized she had diabetes. So immediately I was like, have you ever been talked to about a chronic special needs plan? Went over it with her. She was super happy. We got her a hospital indemnity as well. So she's getting, I think it was $100 food card every month, or maybe it's 50. I can't remember because I'm working in 2 different states and they're different in Tennessee versus Arizona. But yeah, I did run into that. And I believe I ran into it a couple more times. But yeah, like you said earlier, just educating them and helping them realize that just because they lost their Medicaid doesn't mean that they can't get good coverage. That's all you really need to do. They just want someone that's going to look out for them and explain it all to them and take care of them.
Yeah, absolutely. No, thank you for sharing that. I appreciate you.
Yeah, you're welcome.
If you guys feel like it would be helpful to dive into Medicare Link, drop a link in the chat because we can go ahead and do that. I know that we have our last 2 trainings, we have dove into it, but if anyone has any questions in Medicare Link, we can kind of start off that way. But if you guys find that helpful, let me know. I don't want to be redundant with the last 2 weeks that we've done, but if it's something that you want to see again, or if there's specific questions you have in Medicare Link, we can kind of dive in there together. Does anyone have anything? Mara, you're unmuted. I don't know if...
Oh, I'm sorry.
Oh, no, you're good.
One thing I was gonna say is I learned when I was using it over the weekend that if you Medicare app auto populates to like the lowest premium, I think, or like max out of pockets. But Medicare Link is super helpful with like the drug cost because it really breaks down the drug cost. So like if you're using the filter with the plans, and if they have like high drug costs, I feel like that was the most helpful way for me over the weekend to filter through what are the best ones. I would just do like estimated drug costs because that was where a lot of the people I was meeting with, they were struggling with like their copays on their drugs. So that was just like one tip that I learned. I don't think Medicare app you can do it like that. So it was nice to be able to do that in Medicare Link.
Yeah, definitely. And I know too, there's a couple sites that I've used for different things. Like in here, Teresa had asked, she said, I know you were discussing the best way to confirm Medicaid numbers outside of calling WellCare. So one that's been helpful for me is United Healthcare. They have a Medicare eligibility check on there. But were you asking Teresa to actually find the Medicaid number on there? Oh, okay.
And
okay.
level, to confirm the level, because I had one the other day that the client had a card that just had QMB on it, and Billy was like, call that and verify it. And I was like, well, I need to call and verify it. They just got the card, called it and verified it, and they're QMB plus now.
Oh, okay. Okay. Well, yeah, yeah, Medicare Link will show obviously the LIS level and like that they're eligible for Medicaid, but not show us the level on there. So I really use the WellCare hotline.
Okay.
And if I have the Medicaid number, then I'll plug it into United Healthcare's Medicaid. And I'm looking up for a specific plan. And the reason I'm looking that up in that plan is because I know that depending on knowing your plans in your area, what level is required for them to be
Right.
approved on that.
Mhm.
So you can use like I think once you get in there, have you used that one before, Teresa? United Healthcare?
Yes. I hadn't used United Healthcare to look up anything for Medicaid yet. No.
Oh, okay. Yeah, that's been helpful. I can show you guys that real quick. Let's see.
I think, aren't you supposed to also be able to find that in Ascend?
Yes, I've seen that. I know they say it every time.
I
when
went to it, but I couldn't find it.
I couldn't either. But I have used this. I'll show you guys this real quick. Let's see.
Oh, somebody uses Devoted.
Yeah, I was gonna say Devoted. I was gonna show you guys here in just a couple minutes.
Gage is just saying that you can, basically any of the carriers, you can find one in there, but whatever one is quickest for you, I guess.
Oh, okay. Yeah, and then if you hop over here to Medicare, Medicaid eligibility in United Healthcare, you click right here, and then you just go over to Medicaid eligibility. And then once you type in, you know, the state and the zip code, I think it's gonna know what, you know, it's gonna pull up those D-SNPs in your area, and then you can kind of check it out. See, I've got like a perfect example right here. So this one is Carol Merrill. Her birthday, 8/5/58. Oops. Oops. And then, so hit check Medicaid eligibility. See, so for here, it's gonna show me based on that zip code I put in there, Teresa, it's gonna show me the 2 D-SNPs out here for her. She's eligible for this plan, but she's not eligible for this one right here. So this one, you can see the reason she's not
Gotcha.
eligible is because it's saying it needs a LTC, which is a really, what I'm finding out is kind of a one-off scenario. So
Mhm.
even if she's QMB plus, which she is, she's not long-term care level of Medicaid, which is like, I thought QMB plus is the highest. There's like one more, and who knows, we might find out later there's another one, but long-term care is one of those levels.
Can you go back one screen? Can you go back? Yeah, one page. Or, okay, that's the beginning. So you did have the Medicaid number.
I did, yes, I did.
Okay,
Yeah.
gotcha.
Sorry
Okay,
about
thanks
that.
for clarifying that. Thank you.
Yeah, no problem.
As long as you know their social, you can typically do the same type of search. It's either their Medicaid number or their social. I always use the Humana portal. So it's really whatever you are more familiar with and what's quickest. I've actually quit calling the verification line with WellCare because the Humana one is quick and I can just look it up with their social security number. It's just been the quickest for me. So that's what I've been doing.
On Humana, okay.
Yep.
I was gonna say the same thing. Yeah.
Hey, Gage, I go into the Devoted if they don't have their Medicaid number, and plus if I don't have their social, but you can put in their Medicare number and they'll do the search, and then you can pop up and it'll show you what their actual Medicaid number is.
Oh, that's awesome.
Oh yeah, that's super cool.
So you go here to Medicaid right here and type it in? Oh,
Correct. Yep.
Oh, that's nice, you guys. So I don't know if you heard that, Teresa, but you can come over to Devoted, go into this Medicare search right here, type in their name, date of birth. Yeah, the Medicaid ID is not required. So can you do this with just their date of birth and their name?
Yeah, date of birth, name, and then your MIB number. And then what it'll do is it'll let you know if they're on a Medicaid plan, but if they are, then it will show you their Medicaid number. Like I found a couple of them that didn't even know they was on Medicaid because they was getting QI1 benefits. So yeah, but yeah, you can do that. It'll show you if they are, and it'll give you their Medicaid number.
Oh, okay, that's awesome. That's awesome. Yeah, Devoted's been helpful in searching for different types of things. I was gonna show you guys this too. I saw that my client had like 8 out of 9 prescriptions that were covered. And I just wanted to check with Devoted specifically to see what we could, a different, an alternate prescription that we could get for her. And I can't remember the exact name of it. It was like, it was definitely an insulin. It wasn't, I don't think that it was this one right here. Because it wasn't covered, whichever one it was not covered. And so I don't know if you guys are, see if I can find one that's not covered. Let's see. Is any prescriptions that you found, Ed, that are not covered by Devoted? Or that you found?
Yeah, yeah, but I can't remember what they were.
I know, of course, I can't find.
Was it Ozempa? Is that one of them?
Oh, Ozempic?
Yeah, it was that. I think that was one that wasn't covered.
Interesting, let's see. Oh, yeah. Oh, right here. Okay. So this is what I was going to show you guys. If you have like a one-off scenario, like I had 8 out of her 9 were covered and then 1 was not. So I went in here to the drug search and it says show covered alternatives. So I clicked here, and if she was on the, 1.5 milliliter pen, then I went over here and looked for that similarity. So for me, it was this Trulicity here. You can see it's the same tier of drug, but what I did is I saved it to a list. So I saved all her prescriptions in a list, but then this one here, I made note of this one, for her doctor here. And I know this prior authorization required here. I don't know if Michaela, Gage, or maybe Ed, you're familiar with the prior authorization. Michaela, would you want to break that down for us real quick?
Yeah, so it's just for insurance carriers, they want to make sure that the doctor is actually like requiring them to take that medication still. So if they switch insurances, they need the doctor to authorize that medication, just because they just want to make sure that they have to take it. Like I have to get one for my insulin, even though I've been diabetic since I was 15. Like it doesn't make any sense, but they just like require it to make sure that they're paying the claim for a reason, you know?
And it's okay. So they need the prior authorization comes from the doctor to the insurance. Okay.
But you
perfect.
should be telling them, the client, because that's what happened to me. Like my agent didn't tell me that. And then I went to go pick up my prescription and it was like $1,000. And I was like, what the heck? And they're like,
Yeah.
your insurance isn't covering it. And I'm like, what the heck? It's supposed to cover it. Like it's in the formulary, but I wasn't informed that I needed a prior authorization. So if you see that, you should definitely inform the client to tell their doctor that.
Okay, perfect. I wanted to make sure I said that correctly because that's why I saved this list I added this to the list, and then I downloaded this and sent it to my client and then highlighted the one that we added that wasn't covered that we're looking to like replace the Ozempic with, right?
Mhm.
And I told them, hey, look, I don't even know why, but I downloaded this because it said more details, and I was like, if your doctor needs this, I don't know if she does, but that was the instruction I gave, was like, you need to have your doctor authorize this to the carrier. And
Yep.
then from there, her coverage looks a lot better. I mean, her annual out of pocket, I remember for one drug being out of network out of the 9 was like 36,000 for the year. And we could reduce that to like $200 for the year if they will give her that other prescription. So that's super helpful too, is just finding an alternative if they're open to that would be in there. But then also just letting them know, hey, look, not everything works for everyone, because I know for this exact example, Ed, I had someone who Ozempic was one in a different case, and they're like, I had an allergic reaction. So now after I heard that, I've told people, hey, look, not everything works for everyone. So if there's anything that goes wrong with this medication, let's just go ahead and reevaluate in the beginning of the year and make sure, I'll advocate for you on whatever plan we need to move you into, or whatever extra coverage we need to get to make sure we can get your costs lowered. Because there is a way to get these costs lowered. It's just like really diving into it and looking into it. And Devoted's portal helps with a lot of that, just because they have those alternatives in there, which I assume the other carriers would have that too.
Yeah, and Medicare Link does too. If like you're typing the medication in there, you can click like show generic. And that is something actually that like separates you from other agents, like from my own personal experience. And I know our clients' experience, like if you're really diving in and helping them with their meds outside of just what the insurance company shows and like plan details, that definitely is going to separate you, like going above and beyond for them. So do it if you can.
Okay, that's good. That's what I was gonna actually ask next too. If there is a place to do that in Medicare Link where it tells you like with that carrier specifically that it would save them money on if you went like preferred, because I know it tells you like generic, preferred generic, all those levels. Does it give you a recommendation on
It doesn't, it's not carrier specific. If you just go to, so click quote and enroll.
Mhm.
Oh wait, I guess we gotta have a, or do you have a current client already in
Yeah.
there maybe?
I don't have anyone that's like not enrolled. I have to like always.
You can go to someone that's already enrolled too,
Oh, okay.
like just a current client, so.
Just go to the main dashboard and you'll see your contacts and you hit the 3 little bars, yeah.
Yeah, one of those, yeah. So go to, yeah, view quote, click quote, yeah. View all plans.
Oh, sorry. Oh, let's see it.
Sorry, on the right hand side, yeah. And then we go to, I guess you could have gone to medications, I apologize, and then
That's okay.
medications.
Okay.
And then like, let's do, for example, let's try,
Like Ozempic?
yeah, let's try Ozempic if there's it.
Okay.
So that. Oh wait, I guess that one didn't pop up. It
See,
would
sometimes it-
pop up on the top, like show generic.
Yeah, it doesn't do that on all of them. That's
Mm,
why I've been using. So that's it, kind of like, this is like one of those cases where, see, I think, Michaela, maybe if it's I don't know, maybe if it's covered by like a lot of these carriers that is like in this selection right here for her.
Right.
Maybe, you know, but if there's less, I guess.
Try
Available
getting, or Eliquis.
Eliquis.
Yeah,
See.
try yeah. Okay,
Yes.
press add and see if it does anything. Okay, never
No,
mind.
see, that's so
Yeah.
crazy, because that's what it used to do for me. I was like, oh, okay, I can select right here, but it's not in every case. Like it, that changes.
Try Plavix.
What is it?
Plavix.
PLA, yeah. See, there it is, show generic. What the heck?
Yeah,
Hell yeah. I just, because that just happened to me when I switched that his and hers. She was
Mhm.
taking Plavix, and with WellCare she was paying $0 for it.
Mm,
And then when I switched her into the Alignment C-SNP, she was paying with WellCare, she was paying $0 for her Plavix. But then her Trulicity and then I believe Jardians, those ones were like $400 and like $200 for both of those diabetic ones, right? So when I
yeah.
switched her into Alignment broke those 2 diabetic medications down to $30 each, but then the Plavix was like 200 something, which was funny. But it's you know, it's all with the formularies with each carrier, right? So with Plavix we ended up finding an alternative. What is it? Is it the
Clopidogrel.
yeah, that one. Yeah, so I told her to write it down, and that way she can tell her doctor, hey, can we switch to this one, just because it's getting expensive on my new insurance. So
Yep.
yeah.
Okay. So then if we go to drug cost details here, so adding that generic in there. Let's see. So
290 for Clopidogrel. Yeah, because you just put the Eliquis, we didn't find a generic, so it's just showing the.
oh, that's right. Okay.
That's per year, so like the 538 on the top is gonna just show up per year, then you scroll down, it's gonna show up per month. See how it says like January?
Mm-hmm. Yeah.
So it'll show like what it would cost per month, which is only $11.
So, and that's when, like, what I would do here, you guys, is like, if I was going with like Devoted, a big one that I would go with. So I would take the Eliquis here and just type it in here. And this is, I know why Gage and Mar and Karina talk about the importance of building a relationship with your BRM out there in your market, because like for Devoted out here now, I will just call her up real quick and give her a quick question and she'll tell me exactly what to do. And so it's really, really nice to have that if you haven't like dove into these back portals yet. But see, Eliquis here on this one, the starter pack, I could go to show alternatives on here. And then, you know, I would advise them to take a look at getting one of these in here.
Yeah, that's cool. I've never seen that in Devoted because I haven't wrote a ton of Devoted.
And then it's nice just so you can like save it to a list on here. But yeah, I mean, This is just, I just assume that if there's like one for devoted, there's probably something we could find with the rest too. You see something? Medicare link. I'm gonna check the chat, see if there's any questions. I don't think we have any questions in here. If you guys have any, please drop your questions in the chat. Otherwise, we can go over this week's numbers. I know we have we had our Reagan down here for a second, being able to pull the life and annuity reports. We have some of it up and running, but not everything yet. So we apologize that some of these numbers may be off. That's part of the reason why we wanted to push till today from last week as well, is because the numbers, we couldn't pull the reports. But we do have our slides here, so I'll go ahead and get started on this. So again, these numbers can be a little bit off. I know this is the submit, so this should be fairly correct for this last week. So we had 12 life applications, 72 health, and 1 annuity. So great job, you guys. We had 18 riders and 85 total applications. And for submit last week on the life side, what we have is Angelica, 2 applications, 1,128. As you can see, there's a lot of people running Medicare right now. Number 3, JR, 1 application, 1,404. Number 2, we've got Marcus McCall, 3 apps, 1,424. And then number 1, David Hadley, 1 application, 30,000. Great job, David, on that. I know that's just the AP, so I believe that was a $300,000 annuity that you got through. So awesome job. Drop a David in the chat. And then we've got our Medicare numbers here. We've got Michaela at 2 enrollments, Corinne at 4, Angelica at 5. We've got Mar, Jared, and Beto all at 7. Running up with Gage at 8 enrollments. Joe, we've got 9. Anders, great job, Anders. He's running up devoted out here in Arizona, 15 applications. And then we've got